Thank you, Chairwoman Eshoo. Today, the Health Subcommittee is beginning the critical process of reauthorizing the FDA's user fee programs for prescription drugs, generic drugs, and biosimilars. We'll also discuss FDA's agreements with industry stakeholders on improvements to the review and development of important medicines. The fees collected from these programs support the timely review of drug applications and other activities needed to support drug development. And as such, these programs are essential to FDA's mission. They ensure that the agency has the resources and personnel it needs to review and approve safe and effective medical treatments in a timely fashion. The current user fee authorizations expire later this year on September 30th, and it's critical that we pass these reauthorizations well ahead of the deadline so that FDA can continue its operations without interruption. Over the past 2 years, as we have confronted the COVID-19 pandemic, the American people have witnessed the important work the FDA does every day. The agency has led the critical review process and supported the development of life-saving vaccines that are essential to our efforts to one day end this terrible virus. The FDA has also reviewed and approved important therapies that are helping people fight the virus. And it has also helped to respond to medical supply chain issues that have led to shortages of some medical products. The unprecedented nature of the pandemic has stretched FDA to its limit over the last 2 years, and the entire FDA workforce should be commended for their outstanding work not only in responding to this pandemic, but also for continuing to do all the other important work they're charged to do. As we continue to face the COVID-19 pandemic, we simply cannot put FDA's funding in jeopardy, and that's why we must act expeditiously to reauthorize these important user fees. It's also why Ranking Member Rogers and I, along with our counterparts on the Senate Health Committee, sent a letter last week to Acting Commissioner Woodcock expressing concern the FDA and industry have not yet reached agreement on the medical device user fee program. This is troubling because we're now more than 2 weeks past the statutory deadline for Congress to receive the agreement, and this deadline is set by law. It's not a mere suggestion. It is in everyone's interest for FDA and industry to reach an agreement, and I look forward to receiving a status update soon. The proposed legislation and performance goals for the drug programs before us today show the progress and improvements that can be made with these user fee agreements. The performance goals include new policies that will help increase the consistency, efficiency, and effectiveness of drug reviews. The proposed legislation strengthens staff capacity for the review of cell and gene therapies, improves review timelines for complex generic products, and develops a more competitive biosimilar market. So it's my hope that these proposals from FDA will lead to a more efficient and effective review of drugs and biosimilars while maintaining the agency's highest standards for safety and efficacy. The focus on safe and effective development should ultimately provide for a greater number of approvals of life-saving drugs and improve competition in a way that will help lower costs for our healthcare system and the American people. And Madam Chair, if I just may ask for a moment of privilege and address the subcommittee on a different topic. For those of you who have not yet heard, Kim Tresiak, the subcommittee's Chief Public Health Advisor, will be departing after nearly 7 years on my staff. Kim was one of the first hires when I became the Democratic leader of the committee in 2015, handling the FDA portfolio first and then being promoted to lead the public health team in the majority, and she shined throughout. This committee and Congress have taken so much action over the last 7 years in the public health space, and Kim's fingerprints are on each of these laws. She's been a trusted member of my team who has dedicated her career to public health, and I'm incredibly grateful to her for her service to our country and for her counsel over the years, and I wish her nothing but the best. And with that, Madam Chair, I yield back.